Another fantastic contribution, I have to say. We're changing tack slightly, still staying very much on the digitally enabled change theme, but as we've been doing over the course of the summit, looking at both patient-centric initiatives and workforce-centric initiatives. And our next speaker is Killian O'Mahoney. He's Head of Sales with Softworks. Softworks, as many of you know, is an Irish success story. Established here in 1990, the firm now has offices both here in the UK, the USA, Canada, Germany, and Italy. It's a leading provider of workforce management software. Killian's role within the organisation is to focus on overseeing the development and delivery of workforce management solutions that assist healthcare providers to manage complex staff rostering, time and attendance, and planned and unplanned leave, which is an enormous challenge in most healthcare settings. Killian assists healthcare organisations to streamline those processes, improve operations, and reduce costs by providing a completely automated end-to-end healthcare workforce environment, which I know will be of interest to many of us in the room. Killian.
Thank you, Fergus. It's lovely to be speaking here with you all today. I'd like to start off by echoing Jerry's comments from this morning, which was yesterday was one of the highest quality lineup of speakers and really informative sessions I thought overall. I have to say we really enjoyed it. Myself and the Softworks team were driving home yesterday, brainstorming ideas and things we learned from all the challenges that are occurring within healthcare and the solutions being driven. So it was great to kind of understand and I suppose look at the people that are there to solve it. As Fergus touched on, my session is going to be a little bit different. Predominantly so far it's been heavily focused towards patients, although I would say yesterday there was a lot of touch on moving towards digitalization and understanding how the different staff members in each of these organizations have really faced challenges over the last year with high workload, burnout occurring. And what we do in Softworks is we always try position ourselves as, I suppose, people who are there to support these organizations, to support these staff members in delivering that best level of care. And I suppose considering what we can do to help in any way deliver those organizations, deliver really great patient care. My session is going to be how eRostering technology can drive better care delivery, reduce costs, and increase employee engagement across the board. The agenda that I was looking to cover here was, I suppose, a brief introduction to Softworks. I was going to look at different challenges that we see. So those challenges would be very much from, I suppose, research we've done. We have a lot of partners here, we have a lot of clients here who we get to work with and see this and understand these challenges in the front line. But also, this is really all the research that we do, all the things we study is how we can drive better staff engagement, employee engagement, taking into consideration fairness, equity, balancing of rosters, but also making sure it stays within cost. It was touched on a lot yesterday, things like inflation challenges, staffing costs, shortages of staffing, and what we really want to focus on is the better utilization of those staff members to deliver that sort of best patient outcome. I want to then just touch on, I suppose, how technology and eRostering technology specifically can assist in that space. Just to do a little bit of an introduction to Softworks and a little bit about the background. So I know Fergus touched on it there, but we were founded in 1990, an Irish company, head office in Bray. In that time and over the past few years, I think we've realized what we really specialize in is complex rostering, is complex management, is complex engagement, and there's none more so than the healthcare industry specifically. Over the past 4 or 5 years, we've got to work with some really great partners in Ireland, but also the likes of UK, Italy, Germany, most recently US, and it's so interesting to see that the challenges that are there for each of these countries are very similar to what we're facing. We really want to bring our experience from the Irish healthcare market and drive it internationally and helping to solve these challenges. What we try to do is with all of our partners, with all of our clients, is understand, I suppose, what little impact we can make to make a difference. Some of the partners we've got to kind of work with throughout the Irish market have been, and a number speaking, I know Bill was speaking yesterday from Bon Secours, but a number of different key partners across these whether it be long-term care, which was a lot of the sessions yesterday, and we have partners in that space too, but really focus on the different challenges that are occurring within the healthcare space. I think what we can openly say and was acknowledged yesterday is every healthcare organisation has challenges with staffing, so getting the right qualified people there, and then managing those different people. So not just looking at the patient outcome, but the people who are supporting those patients to drive that best outcome. Taking into consideration things like the staffing shortages, the hours that they're available to work, giving them some control so that they don't experience burnout. Looking at fairness and equity of these rosters, making sure that it's treated equally across the board, making sure that you have, again, Jerry touched on it, the right people in the right place at the right time. So looking at the skill mix, the specialization to make sure that that sort of 60 minutes of care initially is the right person delivering that care when it's actually started. But then there are also things like managing unplanned leave and making sure that that doesn't shift. For this, I'm going to focus on 3 key areas. That's going to be efficient rostering and patient care. It's going to be employee engagement and the benefits of this, so how having the employees really engaged and understanding when they're working, flexible elements to that, is going to drive better outcomes, and then looking at making sure that you're staying within budgets that are there, as we touched on with the kind of increase around that side. I think when we look at rostering and how it affects employees, we do a lot of these studies, which I'll touch on next, but even externally, we make sure that the information that we get is validated globally. So someone like the Harvard Business Review reviewed 153 different academic articles looking at how non-standard rosters affects employees. So rotational night shifts, which is applicable to everyone in this room today, it can lead to higher absenteeism, it can damage productivity, it can have effects to well-being. So we sit around and try look at how we can have an impact to help that. That's been things like giving employees input to their roster, allowing them to, I suppose, suggest when they're available, request days off, making sure that they have control over those different points. When you get into it, what we've seen is where employees are involved in the rostering process, what they want is understanding what's important to them, so giving each individual person control over that, whether that be a preference towards night shifts, day shifts, morning shifts, weekend shifts, whatever those different scenarios are. Looking at their attitudes towards rostering, towards overtime, where there are these staff shortages and gaps in rosters on certain days, allowing employees to actually put their hand up and say they'd like to pick up that shift on a certain day to fill that gap is so important. And obviously then employees who feel their voice is heard are 4.6 times more likely to feel empowered and do their best work. So with the studies we've done with various clients throughout the world, we've looked at when rostering, what do employees want? And that's going to be a fair distribution. So fair distribution of shifts, making sure that everyone's treated equitably, making sure that the right people are in the right place at the right time to deliver that care, and giving them flexibility, things like shift swaps. And what we've seen is Ireland's healthcare market is making a huge push towards digitalization in this space. So stepping away from kind of paper-based scenarios where these requests become difficult to manage, where people are on phones ringing somebody to get somebody in to deliver that last level of really important care. And nowadays, it's moving towards being able to proactively push this information out to those individual employees as well. We try drive the tools and innovation that allow them to organize their work easily. eRostering technology it's a big point in healthcare at the moment. There's open frameworks at the moment around HSE technology, around eRostering technology for the HSE. It's a key point of reference towards what they're doing at the moment. And that's going to be looking at how employees can be very much brought into this discussion. When you look at eRostering, what does it look like? So at the moment, we're seeing a lot of time lost to patient care by managers who are sitting down and documenting all these preferences, all the availability, all the staffing requirements that they have, and trying to step away and build a roster. And this goes from taking days, potentially a month to complete. What we're trying to drive towards is an automation where all of this logic is built into an application. We're using technology around machine learning in the space now to look at how you can make sure that you have the people with the correct skills, the correct availability, the correct contract hours, the correct preferences taken into account to completely automate this. In its most sophisticated use, one of our clients went from spending 2 days per month building a roster to 4 minutes. And that was not just a kind of quicker roster, it was a more considered approach for what is right for that individual employee. With that, cost has become a major factor as we're kind of seeing it increasing that space. So it's not just cost for the monetary side, but it's also looking at things like getting the correct patient ratios to nursing levels. So looking at things like patient acuity metrics to compare that just because you have 10 patients in 2 wards, that doesn't make them the same. You can have different requirements, different acuity metrics, different capacity, you can have different severity levels of the illnesses that they're treating. So building in that kind of logic to say, we want to ensure that the patients get the best care, taking into account seasonal fluctuations for staffing levels, taking into account overtime being used, and actually trying to reduce agency spend. We have a lot of conversations where organizations are offering out shifts to agency and they aren't getting an understanding of how much that's going to cost until the month after. They're looking at budgets then, it's then damaging the recruitment side. So now we're working with a number of kind of the largest UK providers in healthcare around better utilising those staff to work towards agency reduction projects, for offering out bank shifts to their staff with incentives on this, to push forward that they're correctly utilising everyone that they have, the really, really skilled workforce that they have in place at any point in time. Making sure that when you're looking at these different shifts, that it's considering the continuity of care for the patients that the service is being delivered. So making sure that it's not just about having someone who has these skills. We're seeing, particularly in the long-term care space, people who have a familiarity with that patient and understanding their needs, their challenges in that specific way. The outcome is driven the outcome of that is significantly highly driven for that individual patient as well. When you then look at the employee engagement side, so obviously with employee engagement, we very much recognize we're only a really small part of this, but we're trying to be as important to it as we can to give every employee their ability to be heard in this space. At a very simplistic level, when you look at employee engagement, increasing productivity and efficiency is a key metric of that. It was really interesting yesterday hearing, again, Bill from the Bonsigurs talk about how people are at the heart of everything they do. They want exceptional people delivering exceptional care. And that's really what we focus on, is those exceptional people getting the best place to have their voice heard in a system. We've had to change how we do this throughout remote working, throughout COVID. We've worked with a lot of clients where the administration staff have now moved to a more remote working capacity. So making sure that employees have the ability to do things like complete surveys online, give feedback on their conditions, on their working conditions, on their individual preferences has become such an important piece of this. And it's assisted in building that sort of positive workplace culture. We always say in Softworks that we honestly believe everyone who delivers care is almost a different breed. It's such a caring world. It's such a great world for anyone who works in that space. And really with it, we kind of recognize that there's always that willingness to do more, but it's also important to look after those staff and make sure that they have the opportunity to have their preferences taken into account. That covers things like communication to these staff. How are they being told when they're working? How are they being kind of given out their rosters? Are they being given in advance? Can they plan that sort of work-life balance on it? Is fairness considered? Is making sure that everyone gets an equal distribution of these shifts throughout these different periods? Is there clear goals in their jobs? So making sure that the ability to kind of communicate any tasks that they have to do easily is driven through mobile app technology now, is letting them pick up this information at the click of a button. Managing the sort of recognition, so we're moving towards kind of recognition peer-to-peer in the application, so allowing each employee to kind of recognize all of their individual colleagues' goals and achievements that they've done, so that it's kind of clear the value and impact that they've had in these different organizations too. And then obviously controlling the kind of motivation through that. So from kind of external sources, we've seen that organizations with engaged workers are 17% more productive, 21% more profitable, 41% lower absenteeism rates. They have a 24% lower turnover, which again is such an important piece where the recruitment is such a key factor for these organizations. So making sure that they can retain the staff they have by giving them the correct input to that. From the technology side, we can see in the HSE, for example, how time can be reduced on administrative tasks. That's simple things or complex things. So from the complex things, it's things like building in all that logic to automate that, taking that from people's heads and putting a software application in place to click a button and automate that roster. In the more simplistic tasks, there's things like very administrative tasks like report building in the HSE, where we're very much trying to keep that at the forefront of everything we do technology-wise. So things like the census reports, the national absenteeism reports that people are sitting down and documenting at the moment, having them available at the click of a button, and building in policies in line with kind of HSE calculations and rates, and understanding the enhancements that are in place for these different organizations, managing things around the kind of rolling absences. And these all seem like quite trivial tasks, but they're taking frontline workers days and hours to complete on any given basis. We want to make sure that with everything we do, customers are at the forefront of it. We've a really skilled project team we've implemented in so many different healthcare organizations in Ireland that we're trying to share that best practice knowledge between all of our clients to make sure that you have a forum to really communicate this information across the board. The last slide I just wanted to touch on is, I suppose, when we approach an organization and start to work with them, we understand that everyone has these different challenges and needs. So some people will come to us and say rostering is taking too long. Some will have fears around compliance. Yesterday, I know that the Secretary General referenced the kind of paper elements everywhere. So trying to remove paper, making sure that it's all held securely, making sure that all data is managed in the best way possible. Managing how people are paid, so making sure that that's a really important factor at the end of every month, is everyone is paid correctly. We're working on, I suppose, areas around things like instant pay, so that you can pick up a shift today for overtime and be paid for it tomorrow. We're working with partners in that space to really incentivize them to pick up those different overtime shifts at any point. And then reporting and dashboards. So from the technology point, it's with the reporting side, making sure that all this information you put into the system, you can get out in a really easy, clear way. That can then drive better information, better decisions. That can be things like staffing levels, gaps, making sure that all of your staff skill mix is considered, making sure their training is up to date so that they can continue to deliver that really great level of care. We are exhibiting, so feel free to drop down. We have a stand outside. Or on a much lighter note, we are I think the team are giving away a couple of hampers, so come down and put your name in to join that as well. Thank you all.
Thanks very much, Killian. It was really superb. I have to say that is an area, our career take us into different areas of the operation. That was always one that I shied away from. Just that complexity of rostering and all the challenges associated with it. And I found that fascinating. Some of the things you guys are doing is really, really superb. Our final